Yeah. So the topic is designing a questionnaire, framing the questions. Now, what is a questionnaire? Most of us who have completed our thesis or some research project must have used a questionnaire as a tool to elicit and record information or data from participants in a study. So this comes under our method section, in which we mention that the tool which we have used for collecting data is a questionnaire. And why do we say it's a questionnaire? Of course, because it contains a series of questions. Now, the purpose of using these questions is to capture valid and reliable data on the variables of interest, because they are going to help us answer our research questions and also achieve the objectives of the study. And when we want to design a questionnaire, our objective is to minimize errors in the data which we are collecting with regards to the different variables. At the same time, we want our tool to be easy for use, both for the investigator as well as the respondent, and later on for data entry and for data analysis too. So our questionnaire and our questions have to serve multiple purposes when we want to use it as a tool in our study. Now, is questionnaire the only tool? No, there are a number of other tools which can be used for data collection. For example, if you are also doing some clinical examination or anthropometric measurements, or you're taking some lab results, or if you are collecting data from records, registers, or you're doing some environmental measurements, or some observations using a checklist, then please remember that you have to mention them as separate tools of data collection. For example, you're doing clinical examination, you're doing anthropometry, you're also collecting lab results, and you're using a questionnaire. Then in your method section, under tools, you have to mention them separately and describe what you are measuring using both of them, and measure each of these tools in detail. So questionnaire could be just one of the different various tools which you are using for data collection. Now, compared to these other tools, what are the advantages and disadvantages of using a questionnaire? Now, of course, a questionnaire which we are talking about here is the one which we are talking in terms of the quantitative studies. In the upcoming sessions, we will see why are we focusing on quantitative studies. If you remember, in our qualitative series, qualitative research series, we mentioned the use of an interview schedule, which is altogether different from a questionnaire, which we say here are used for quantitative studies. Why so? We will see in the upcoming sessions. The advantages of using a questionnaire is that, of course, it is low cost and aids in rapid data collection. Large amounts of data for a large sample can be collected using a questionnaire. It can be standardized. It can be used in innumerable studies which can be compared with each other with respect to time or geographic location. And questionnaires are useful for collecting background characteristics as well as for collecting data on knowledge, attitude, practices, beliefs, values. Remember that usually these are self-reported data. That could be, of course, one of the limitations of a questionnaire. Now, the disadvantages of the questionnaires are that it only captures information that the method allows for. That is, there is a relationship between the interviewer and the respondent, and how comfortable the two are with each other will also determine what kind of data is collected for each variable. Then, of course, there is a issue with social desirability in the questionnaire. So if the questions are very sensitive or threatening, then the kind of response you're going to get to such questions using a questionnaire will have its own limitation and will depend upon how you frame and ask those questions. Now, the questionnaires which we are talking about, which we want to use in a quantitative research, can be administered in two different ways. One is the investigator administered questionnaire and the other self-administered questionnaire. The investigator administered questionnaire means the investigator or the researcher is going to ask the each and every question through a face-to-face interview. Other options are to collect the data telephonically through telephonic interviews or video conferencing. Compared to self-administered questionnaires, these have higher response rates, and for the researcher, they give a better understanding of how the data are collected and also the context in which the data has been gathered. However, because the investigators, if there could be multiple investigators, all of those have to be trained. This can be very resource intensive. Also, the time of all investigators is invested. And if you look at, on the other hand, the self-administered questionnaire, these are completed by the respondents. Here, there is no assistance from the researcher while administering the questionnaire. Now, this can be administered directly, or it can be mailed through the post email, or it can be accessed through websites. So that people, the advantage, of course, here is that the people or the respondents can answer at their own pace. This results in less cost and logistics. Also, if privacy, confidentiality, anonymity needs to be mentioned, then self-administered questionnaires should be preferred. However, there can be misinterpretations, also low response rate. In an investigator-administered questionnaire, the respondent can ask for clarifications of some questions, which is not possible with a self-administered questionnaire. And of course, the context in which the data is collected is lost in a self-administered questionnaire, which can be described in detail by the investigator as to where, when, how the data were collected. Now remember that actually questionnaire design and framing the questions is a hands-on, should be a hands-on session. So at the beginning itself, I want to declare that this is a big limitation of today's session, that it's going to be just a priming of the topic, because I will be giving ample number of examples, but still there is nothing hands-on here, which is a big limitation. And I just hope that in the future we do conduct some on-site session on this topic. So there are a variety of, important points when we are talking about questionnaire designing, right? From how to identify which are the data items on which the questions are to be designed in the questionnaire, what are the different types of questions. Today, we are just going to focus on open-ended and closed-ended questions, but there can be other ways of classifying the questions in the questionnaire. Then what care should be taken when you think of wording of questions? Then if it's a closed-ended questions, how do you design your responses? Then, of course, other important points like how long a questionnaire should be, what should be the order or sequence in which the question should be placed, the physical format and layout and structure of the questionnaire itself is very important. And then pre-testing, pilot testing, what are the differences between these terminologies, or validity, reliability, what are the different components of validity? And then there are all the questions can be put in different domains. Like what is the difference between, say, knowledge, awareness, attitude, and a series of other domains which are usually included as questions in a questionnaire. And then translation, what are the rules of translating a questionnaire? If you want to use a standard questionnaire which is available, what care should be taken? Can it be modified? What should be done in those circumstances? And then also a few checklists for, say, the questions in the questionnaire. So there are many other things which we can touch upon when we talk of a questionnaire design. And I feel that designing a data collection tool itself is a specialty. And if you take interest, you can become an expert in this domain. So we are just going to consider some very important points, because I am sure many of you all are in the process of finalizing your data collection tools. And this, I hope, will be helpful to you in that direction. So the first thing is how to decide upon the choice of items, that is the variables and then the questions which you want to frame. Now this is basically determined by two factors. One is what is your research question and what are the objectives of your study. And the other important point which you need to balance out is the respondent burden. So let us look at these 2 points in a bit of a detail. Now, in objectives of the study, remember that we want to identify the different variables. And if we want that variable, are there any other specific items which need to be covered? Now, what do I mean by this? I'll tell you in the upcoming slides. So then for each of those items, you have to frame a question. And once a question is framed, you have to question whether this particular question contributes to achievement of the objective. If yes, you include the question, otherwise you have to drop the question. The variables of interest in an epidemiological study will be in terms of the exposure, the outcome, what are the potential confounders and effect modifiers. So you can draw your DAGs to identify these different variables. Then also remember that when you start thinking about these items, variables, and questions, right when you are right at the time when you are writing down your study protocol. So in your study protocol, you're writing your study design in different sections. You also have to write a thorough data analysis plan and actually come up with dummy tables, because there you will know what are the variables and items which are required for the variables to be effective and what how detailed data need to be collected. For example, if you are looking at exposure, say smoking, alcoholism, and you want lifetime cumulative exposure, then you will have to ask the time when the exposure began, when it ended, if it has ended, the frequency, intensity, and if it has varied over time, then all those slots, what the variation have been. So do you really want the data to be so detailed is what you have to think. So even if you are going to, use the data at the end of the study, thinking about all these different aspects begins before the questionnaire development, right from the beginning of the study. So as you're writing down your protocol or even reviewing literature, you need to jot down all the variables of interest, items needed to reach out to those or to come up with those effective variables, and then frame questions for each of those items. So this is quite a tedious procedure. Unfortunately, whenever we are, say, uh, thinking about our dissertation or any study, however, this designing the tool, I feel, is left out and remains a weak section. So we need to really understand how we can build up a robust tool for data collection, because after all, it is so very crucial for answering our research question. So what I mean to say when I say that, supposing you are thinking of a variable, you ask yourself, which variable do I want uh, to use for socioeconomic status? So you say it's Kupuswamy scale. So modified Kupuswamy scale. So you cannot directly ask the respondent what is your socioeconomic status according to the modified Kupuswamy scale. You will have to ask what are the different components of the scales. So if it is education, occupation, income, then what do I need to know under each of these components? And then how do I frame questions to collect authentic data for each of these components, which in turn will help me come up with data for the modified Kupuswamy scale. Are you getting me here?
Yes, ma'am.
Yes, ma'am.
Yes, yeah. Ma'am. So for any variable, you have to see whether you can directly ask the question to the respondent or whether it has some sub-components, and then what is the exact information which is needed, and then you have to frame a question to collect that particular data. So this is something which you should remember under the objectives of the study. The next important point is respondent burden. This means what is the level of demand which is placed on the respondents when they are answering the questions. This depends upon many factors. One, of course, is the length of the questionnaire. So the number of questions which are there and the topics which you are covering, and how much time the participant is going to spend answering your questionnaire. So as a general rule, it is said that it should not be more than 30 minutes to 1 hour. So ideally within 30 minutes, maximum up to 1 hour, you should complete your data collection using a questionnaire. Now there is always a temptation to, add on a few more questions and see whether some other additional research question can be answered in the project, because we always feel we are going to put in so much of an effort. So why not think of some other, topics which are related to this particular primary topic and try and little bit expand the scope of our research. But doing this can be very hazardous, and it is very important that we resist this temptation. And we do not add any questions which are not directly related to the study objective. So you have to always ask, is this question going to help me answer my primary objective, at the most my secondary objectives, but nothing more than that. because that is going to lengthen your questionnaire and put additional burden on the respondents. And then what happens is mentioned in the next slide. The other point which puts a lot of burden is recall period. That is, how distant in the past are you going and asking the respondent to recall and answer your question. So if you are going far in the past, it's going to put a lot of burden. Similarly, how important or salient is the topic to the subject? If it is something very, very common, not very important, then it is going to again put a lot of burden, because it is unlikely that the respondent easily is able to remember and answer your questions. Then, of course, if you are asking some very sensitive questions or threatening questions or something which is related to, say, legal matters, or there is some socially undesirable behavior about which you're asking, say alcoholism or domestic violence, then again it is going to put some burden on the respondent. Then again, another important point is the frequency of events. Something is happening very frequently, like eating. Then you are asking in detail about this frequent events, means the person has to remember each and every event, its frequency, the details, which might lead to a lot of confusion and again increased burden. Then the complexity and detail with which you are asking on a particular variable. For example, you are asking a detailed occupational history with all the details of exposure. This also is burdensome for the respondent. And the final point is a proxy respondent. That is, you are asking information about a person from a family member, a neighbor, or a friend. So the proxy respondent is always going to find it burdensome answering the data for someone else. So this is something you have to remember and try. And the objective here is to reduce the respondent burden. Are there ways and means where you can reduce the respondent burden? Now, you have to reduce the length of the questionnaire. You have to see what is the minimum recall period which will give you valid data. You have to avoid asking questions on, very common topics. Sensitive questions need not be dropped, but how do you frame them? You have to be more careful when you frame and you ask sensitive questions. So again, if you are asking some complex question, in the upcoming slides, we will see what needs to be done for those complex concepts. Now, these are, again, I'm going to give some very extreme, sometimes some silly examples also, just for you all to remember these points. So if you are asking a mother, how many times did your child have fever during the last 5 years? So it's a very long recall period, and you're asking which might be relatively common and difficult for her to remember. How many biscuits did your child eat every day in 1 year or 12 months? Or the medicines your child has ever taken? Or you ask 100 questions and it lasts for 2 hours. So these are all something which should not be done when you are designing your questionnaire. Now, if you increase the respondent burden, what will happen is that your interview will be terminated before it gets completed. The quality of data which you obtain will be affected. The response rate to people will be low, because by word of mouth it will spread that this person who comes for the interview comes with a very long questionnaire and we have to spend nearly 2 hours. So others are not going to then, agree to participate in your study. And then, of course, if it's a longitudinal study and you want to do a follow-up and you have such long questionnaires, then there will be high attrition rates. So it is very careful that you ask yourself these two questions: that are my questions going to help me answer my research question, achieve my objectives? And am I putting too much of burden on the respondents when they are responding to these questions? So are we clear with these points?
Yes,
Yes,
ma'am.
yes, ma'am.
Now, the next thing is the types of questions. So we are looking at the questions now, which is the prime focus of this session. So based upon the responses, we have two types of questions. I'm sure you all know about the open-ended questions and the closed-ended questions. So the open-ended questions where there are no pre-listed answers. So you do not provide any answers to the respondent. So usually if you have simple and factual data which you want to collect, you use open-ended questions. So you can ask what were the symptoms your child had before being taken to the health facility. And she will enumerate some symptoms which you write. So you do not have any pre-listed answers here. Here the respondent will answer in their own words and you will record the answer verbatim. Now, of course, we have seen these types of questions in qualitative research, but the open-ended questions which you use in quantitative research are very different from the ones which we use in in-depth interviews or focus group discussions, where there is extensive probing and you want to cover all aspects of a given topic. Such kind of probing is rarely done in quantitative research. Because if you do probing and if you keep a very open-ended question, then the responses are not going to be simple or factual, right? You're going to be getting much of textual data as responses, and then it is going to be burdensome for you to code and to analyze if you're doing a quantitative research. So remember that when I say open-ended questions, these questions are different in qualitative and quantitative research. So usually in the quantitative research, when I say open-ended questions, these are questions which will collect simple and factual data. And usually there are a large number of possible answers which you cannot categorize, or if you want to mention it, all of those answers, it is going to be a very long list and you do not want to categorize but collect granular data, then you will use an open-ended questions. For example, age. You do not want to collect data in categories, you want the granular data. So you will just mention age in years, so they will write the age. If you want, you will categorize them later on. Similarly, this is another example from the NFHS tool. How much agricultural land do members of this household own? So this is factual data, it is simple data. We are not able to predict what the answers will be unless you really put them into some categories which you do not want to do at the beginning of the study. Then you will design this as an open-ended question. However, there could be some sensitive questions, say data related to income. Now here, the respondents may not be very comfortable mentioning the exact amount. So, though it would be good to keep an open-ended question, you will get better response if you reframe it as a closed-ended question and put the responses in income categories which would be acceptable. So you have to then think what are the possible responses and whether it is a good idea to keep it as an open-ended response or to convert it into a closed-ended question with some categories. But when the responses are likely to be simple, factual, and there are a large number of possible answers or answers which you feel you are not able to guess as an investigator and put it in any categorical form or in a closed-ended form, then it's a good idea to keep it as an open-ended question in a questionnaire, even in quantitative research. The next type of questions are the closed-ended questions. Now here, the investigator specifies all the possible answers and the respondent has to choose the answers. So there are limited number of possible answers. So again, the data is simple, factual, but the answers are limited in number and therefore you can mention them as options. So such questions could be about the sex of the respondent, country of residence, or the number of household members who are there. So if you have a rough guess about what could be the different countries which the respondents are coming from, or the range in which the household members are there in your study population, you can frame this as a closed-ended question. Now remember that you are providing the response options and the respondents have to make an appropriate choice. As an investigator, your job is to anticipate what the responses will be and to categorize them properly in advance. So the questions like the binary response questions, do you own a radio? What is your sex? You can give different options. What is your marital status? You can give different options and the respondent will choose the appropriate response. Now, if you're using a self-administered questionnaire, then it is very likely that you will prefer a closed-ended question because you need the questions to be simpler in a self-administered questionnaire so that the respondent it's easy for them to understand and to respond. And In many cases, for self-administered questionnaire, you use automated data capture systems which can capture such closed-ended responses easily. And if you want to add your open-ended questions, then if it is an investigator-administered questionnaire, it is a better idea to add it in those cases. So now when you are looking at the closed-ended questions, there are two important components of a closed-ended question. One is the question itself and the other is the response options. So as an investigator, you have to now think what is the proper way of framing the question, and then what are the different response options which will be appropriate for that question. So we will look at these two things separately. Let us first focus on the question. So the question wording. This has to be very, very suitable because small changes in the wording will bring about different responses. For example, if you ask, where do you normally seek treatment when your child has fever? The response you get will be different than when you ask, the last time your child had fever, where did you first seek treatment? So a small change in wording and you're going to get different responses. So you have to be clear with your objective and you have to ensure that your question is in line with your objectives. Then you should avoid jargons, that is any kind of abbreviation or scientific jargon or any phrase or any difficult word, because the respondent may not understand at all or may misunderstand the question. So wherever doubt exists, always prefer simple words. So you cannot use the technical word ECG. When you take, for example, you are asking, have you ever had an ECG, which is an abbreviation. So you have to give other alternative simple words which are used by the respondent community instead of such abbreviations and jargons. So other examples of such jargons could be GDM, ANC, hypertension, diabetes, ATT, COPD, which are again abbreviations. So the respondent may not know. For example, we were working on this project on GDM, and as a team, we became very comfortable using the word GDM, GDM. So what was observed that when we went into the field and we were talking with the health officials, the medical officers, we were using the term GDM, and the respondents were really not understanding what we were talking about. So we have to be really careful about these jargons which should be avoided in the questions. Then are your questions or the words you're using vague? Means different people will infer different meanings of those words. Now, if you're looking at frequency, the words usually, normally, regularly, these are vague descriptors. So if you say, how old were you when you first began to smoke cigarettes regularly? Now, each person is going to think of this regularly in very different way. You need to be more precise if you want to remove this uncertainty which is linked with the word regular. So a better way of framing the question would be, how old were you when you first smoked one or more cigarettes a day for 1 month or longer? So this will give some more clarity, remove the ambiguity, and the person may be able to give you a valid response. Another important point to remember when you're framing the question is to avoid a biased or a leading question. What is a leading question? The question itself is suggesting that the respondent should answer in a particular way, which is preferable. So if you say, do you think that smoking should be banned in planes? Then this is a leading question. So you should replace it with neutral terms in the question. So you put both permitted or not permitted, and then put those options, and it is up to the respondent then to answer this neutral question. Another example is, do you think the improved services at PHC are better than before? So again, when you say improved services, it becomes a leading question. Instead, you can say, compared to 1 year ago, how would you rate the services at the PHC now? And you give them alternatives to choose from. So when you're framing your question, check whether they are leading questions which should be reframed and made neutral. Another thing to be avoided is double negatives. Now, this again is a very extreme example, but should government hospitals not provide free medicines? Now, this is very ambiguous and is tricky for the respondent. So you frame it in a simple fashion. Do you think government hospitals should provide free medicines? Or a more better fashion would be, who should pay for medicines in government hospitals, and give possible responses from which the respondent can choose. But never put double negatives in your question. Then, of course, the ambiguity with regards to the period for which you are asking the question. If you just ask, do you walk for exercise at least once per week? So, are you referring to the current time? Are you referring to the past, and how far in the past? So, you have to be very clear about how far in the past are you asking about a particular exposure or the outcome. So there should be clarity about time reference when you are framing your question. There are, of course, aids to recall when you are asking a question in which there is recall, about which we'll see in the next session. Another important thing which needs to be done is now coming to those questions which have a complex concept, or they are complex in nature, or some kind of calculation needs to be done by the respondent, or the question itself is covering more than one concept. Here, what in such situations, what needs to be done is decomposition. It is what we are going to see in the upcoming slides. So supposing there are more than one concepts. Now you should never actually pose any question which covers more than one concept. For example, think about your diet over the past year. How often did you eat a serving of fruits or vegetables? Now you in your study may be using fruits and vegetable intake as a single exposure, but the respondent would be more comfortable answering these two as separate categories. So you do not mix this up when you are framing your questions. So you have to really think through the answer. When you're designing your question, you have to ask, how would the respondent answer my question? They will think of the number of times they have eaten vegetables, then they will think of the number of times they have eaten fruits, and they might add them together and give a response. So if you think this is what is going to happen, then you have to decompose your question into two questions. So this is a very important method, because many times we see that we are adding two or three different concepts in a single question, and the respondent will then be really confused as to what to answer. So you have to break down the large or the long question into manageable sub parts. So now this example, as I told you, question needs to be broken down, one for the fruits and one for the vegetables. So how do you do this decomposition? Is thinking aloud interviews. That is, you are asking the question, how do you think the respondent is going to think and answer, and whether there is a need to decompose your question. This can also be ensured or tested in your pre-testing, when you're doing your pre-testing your questionnaire, where you want to break down the complex question into simpler components. So again, remember that there are some questions in which in the background, the respondent is doing some calculations in the mind before answering. There also you have to do a decomposition of the question. So if you're asking, in the past year, how many hours per week did you walk for exercise? Now you know that the respondent needs to break it down into number of times they walked each week, then the minutes they walked per session, then multiply and convert it into hours. So you might think, then why not now break it into two questions? So in the past year, about how many times per week did you walk for exercise? And then how many minutes did you walk each session? Again, in the past year could be a very long, recall period. You might want to edit this and reduce the recall period to reduce the respondent burden. But if you feel that your question is capturing a complex concept which can be, or which needs to be broken down into sub questions, you need to do that. If you feel that this response requires some background calculations, some additions, subtractions, multiplications, then you need to break it up, and later on in your analysis, you can do those calculations yourself. You do not want the respondent to be burdened with any kinds of calculations. That is the idea. Again, there can be some complex concept. The concept itself can be complex for the respondent and put burden on them. This is very frequently seen with when you're doing some kinds of exposure, like physical exercise or substance abuse or diet, where you want to collect data on the dose, the duration, the frequency, the intensity of exposure. So many dimensions come into play. Now, for example, if you say over the past year, did you walk for exercise at least once a week? Now, this walk for exercise, you might define that if there is walking at least once a week for at least 20 minutes per session at normal pace, then it is walking for exercise. But the respondent may not know your definition. So you might think, okay, now let me then define it in my question and make it clear. So you will say, over the past year, did you walk for exercise at least once a week for 20 minutes or more per session? Now, a question which is framed in this way is going to put burden. It is going to annoy the respondent because it becomes a complex question. So again, here decomposition needs to be done. So you have to now think about what are the sub questions which can come up from this complex question. So might be I will first screen and ask them that did they usually walk for exercise? If the answer is yes, then I may ask questions. I need to ask questions about the frequency. I need to ask questions about the duration and about the intensity. And then it is the investigator who will decide whether the all the criteria for walking as exercise are met or not. The respondent has only to answer the questions which are asked. Are you getting me till here?
Yes, ma'am. Yes, ma'am.
Yes. Yes. So if you are thinking that your question is complex and is addressing a complex concept, then you have to think, okay, let me break it out into 2, 3, or even 4 or more questions and make it simple for my respondent. Whatever decisions are to be taken or calculations are to be made, I will do that within my analysis. That will be my responsibility. So you're taking away the burden off the shoulders of the respondent by doing this editing. Now, of course, there are now I would not waste my time really then, designing questions if it is for physical activity. So there are standard questions which are available. So you have this questionnaire which is published by the WHO, and it helps us collect valid data for physical activity. So this is a core. These are core questions which begin by describing what is expected of the respondent. So when you are designing your question, you have to insert such introductions where not only you build rapport with the respondents, but also explain to them if there are any complex concepts which you are going to ask in your questions. This slide is a bit busy, but see how systematically the questions are designed. So the designer of these questions now has gone through in detail. So they have thought, okay, physical activity means at workplace, in travel, and in recreational activities. And then they are asking the screening question that are you involved in some kind of activity? Then in a week for how many days? Then how much time? So the frequency, the duration is involved, and the intensity they have covered in the screening question itself. So they say vigorous, they have a set of questions for vigorous intensity activity and some questions for the same set of questions for moderate activity. And they are using these kinds of questions for all of these three categories. And then you can see the responses. The responses are all either they are closed-ended questions, binary yes, no, or they are open-ended questions in terms of number of days and hours and minutes which have been specified. So you have to really think through how you are going to collect the data. Now, this kind of data collection in such great details then helps us to move ahead and analyze the data and come up with convert all of this into some categorical data with some cutoffs. So if you are well versed with this tool, then you know that you can use this to calculate the met minutes per week and see whether the respondent is meeting the WHO recommendations for physical activity for health. So remember that if you are designing a question, then you have to think what is going to be the variable I'm interested in. If I want to collect some data and convert it into a binary, then what will be my cutoffs? How will I be able to gather the data which will help me calculate the whether the person meets the cutoff or not? So you have to go in a reverse direction, and then you have to design the items which will be needed and the questions which will be needed to gather the information. So here the designer would have thought that okay, I want to calculate met minutes per week, and I know that there could be moderate activity and vigorous activity. The met values will be different for each of them. And all these activities can happen at workplace, transport, recreation. So now let me ask questions, and then they would have designed these questions. So when you are using the questions, you move forward. But when you're designing the questions, you have to think through what kind of data is needed, and then what items will be needed, and what questions need to be framed to get the relevant data. So this is what is very, very important. So here you can see then this tool will help to collect the data. So if you are doing a pilot, you will collect data and ensure that you are getting the values which will help you to decide whether the WHO recommended met minutes per week are met or not. And that will then give you confidence that yes, what you have framed are valid questions. Another example, supposing you are wanting to consider smoking, and if you are interested in lifetime cumulative exposure of smoking dose as your exposure, then you have to now start thinking, okay, if it is if it's cumulative exposure, you will of course keep reading literature. So there you will see that pack years is a concept which is required for assessing the smoking dose. So if what is pack year? It is cigarettes per day into years smoked. Now this is divided by 20 because one pack contains 20 cigarettes. Then what are the items now which you will require if you want to use this formula? So the current use, whether there was any former use, then the duration of use, the frequency of use, and the quantity. Now, if these are the items, then what are the questions which I need to frame for each of these things so that I get all the data which is required to calculate pack years. And then if I get the pack years, I will categorize the person in these different categories of smoking dose. Is this clear?
Yes, ma'am. Yes,
Yes, ma'am.
ma'am.
Yes, ma'am.
Yeah. So thank you. The next thing is, now this is a small exercise which we will do, in which your job is to tell me what is the ideal kind of question for these scenarios, whether it's an open-ended question or a closed-ended question. So the first one is, you want to get information that could be included in future questionnaires. So what kind of question? So there is one question which you want to use to get information so that that information can help you build up future questionnaires. So what kind of question?
Open-ended.
Yes. So open-ended. This means, see, there is something very new which has come to your mind. You are going through literature, but you are not finding any way of framing a closed-ended question. You do not know what kind of responses you are going to get. So you will use an open-ended question, and then all the responses which you get in the open-ended questions, you will use to frame your possibly closed-ended question in the future. The next one is, you want to decrease the burden of data collection and provide answers that will be simple to code and analyze.
Close-end.
Yes, so this will be closed-ended question. You want to get information on simple facts to which there are a large number of possible answers.
Open-ended.
Open-ended.
Yes, so we saw the example of age or the acres of land. You want the respondents to select priorities and preferences among given choices.
Close-ended.
Open-ended.
Yes. So I have not touched upon this, but you give a series of options and ask people to number the responses so that they prioritize the responses. Then you want to get data on simple facts to which there are only a few possible answers.
Close-ended.
Close-ended.
Yes. So we saw the example of, say, sex. So you know that these are 4 or 5 options. So you will use a closed-ended question here. You want to assess the degree of intensity of a feeling or an attitude.
Open-ended.
No,
Close-ended.
I'm again not touched here, but this is talking about a Likert scale, which is a closed-ended question. You think that giving defined cutoff values could bias the respondents' answers.
Close-ended.
Close-ended.
Now, again, actually, this is not a closed end. The option is not closed ended. But even if you want to use a closed ended, there is a trick which you have to use, which I'll tell you here, or most probably when we talk about sensitive questions. But ideally, you should use an open ended question, because if you feel that you are giving some cutoff values and the person is avoiding the extremes, then there could be a biased response. So you have to be careful in when you feel that your cutoffs are going to bias the response. So this is about the questions. So now we move on to the response options. So this is again for closed-ended question. How do you, frame your response options? Of course, they have to be simple and brief. But in what sequence do you place them? What should be the layouts? There are issues about codes, then about markings. Are you going to ask them to encircle the responses or to put a tick mark? So all that comes into picture. But today we are just going to think about the wordings and the proper options, how they are going to be, what they have, and what the sequence should be. So the first important point for the response when you are designing your responses is that they should be exhaustive. Exhaustive means that there should be a response for all participants. Means all respondents should be able to find an appropriate option in the response options which you have given. Supposing one response category is omitted because you have assumed that this response nobody is going to choose, then you can land in trouble. For example, you ask a question, what type of alcohol do you drink? Beer, wine, whiskey. Now you are assuming that these three are there, that you are not assuming that there could be other options, or you're not assuming that there could be a respondent who does not drink alcohol. So one thing can happen is that the respondent will not answer the question because the option which he or she wants to select is not there, or the respondent may feel it offensive and just withdraw from your study because you have made some assumption about their behavior. So when you are writing down your options, you should ask yourself whether I have included all possible responses as options to the question. This is important. So what are the solutions to this? One is that you add a missing category, or if you feel that there could be people who could for whom this question would not be applicable. So you put the category of never, none, or not applicable so that they are comfortable and they are assured that you have thought that there could be people for whom these questions are not applicable. Then you can add a screening question and put a skip pattern. That is, instead of directly asking which alcohol you are drinking, you first ask, do you drink alcohol? Yes, no. If no, you skip the next question. If yes, then you ask about the type of alcohol which they are drinking. So this is another solution. Then if the response categories provided are not exhaustive of all possible responses, you know that, okay, I have tried my best to include all possible options I am aware of, but there could be still some other category. Then you put this option of others, but always remember to mention, specify, or please give details. You cannot just mention others and leave it as such. You have, or the other should always be accompanied by another section which seeks more details or specifications. Now, when you are writing others, you have to be again very careful, because many times when you are analyzing data, you will see that these others end up being the largest proportion, which means that you have not thought through, with enough intensity when you are framing your options. So ideally, this other category should include less than 10% of the responses, and this is what you should check in your pre-test or even when you're doing your pilot test. Are you understanding this?
Yes, ma'am.
So do not put the others category cursorily as an option. You have to think through and you have to say that, oh, majority of the other options have been covered in the response options, but I feel a little bit is left which will be covered by the others option. So here the skip pattern you can see, and again the option of I do not drink alcohol has been added as an alternative, so that each respondent feels that they have their option of choice in the responses. So this is again an example of how others is included in a question from the NFHS question. Then you must have also seen this option of don't know to a closed-ended question. Now, remember that this should be given as an option only if you truly feel that there will be respondents who would not know the answer. For example, you are asking some family history, but the respondent is not biologically related to the family. Then they may really not know, and that option becomes relevant. But what happens if you give this don't know as an option to each and every question? The respondent will find it easy to tick don't know, and you will see that a greater percentage of respondents have chosen don't know, right? So you have to be really sure, because studies have shown that if you do not keep the option of don't know, you get higher proportion of usable responses. So do not use don't know carelessly as an option to your question. Again, if you see NFHS, there are many questions like who owns the house, or questions about bank account, post office account, health insurance schemes. So here again, the pilot and the pre-testing might have shown that the respondents who are available at home when the interviews were taken did not know the response, so they have added this option of don't know for these series of questions. So they have to be exhaustive is one part. The other aspect is the responses should be mutually exclusive, especially if you are expecting the respondent to choose only one option from the responses. So when you want only one to be chosen, please check whether the options are mutually exclusive. If again there is an uncertainty, you create an uncertainty, and the respondent feels that they can choose more than one option, then there is risk of non-response for that question. So for example, if you say how long does it take to reach the nearest PHC and you give these options, so somebody who wants to choose 30 minutes will not know whether to choose the first or the second option. So either they will choose both the options or they will not respond. They might even lose interest thinking that this questionnaire has not been designed properly. So you have to be careful. What are the solutions? One is, of course, to make them mutually exclusive. Like the previous one can be made mutually exclusive by changing the cutoffs for each category. Another could be if you feel that the respondent can choose more than one answers, you will instruct them that mark all that apply. That is, more than one can be chosen. If you feel that more than one response could be selected, another option is to mention yes, no in front of each option, so that for each option they have to say yes, no. And then if you want that more details have to be needed, then you may ask the frequency for all options individually. So I'll show some examples of these solutions later on. So this is a question from NFHS in which they are saying what type of fuel does your household mainly use for cooking? Now might be a household uses more than one fuel. So then they will have to mention mark all that apply. Here is another question. From which sources have you received information about anemia? So might be the respondent has received the information from more than one of these options. Now, but the question arises, which of these is more important or most important for the respondent? Because might be in your objective that is what is of prime importance. So then what you will do is you will ask, how often do you receive information about anemia from the following sources? You list out the sources and then you give them these options from which they can choose, so you can identify which is the most important source for each respondent. So this kind of, designing a question is known as the matrix format. So in the next class, we will see that there are different formats in which questions can be designed. So this is a matrix format. In fact, these are matrix format means what? There are multiple questions. So you are using a trick actually, and you are using multiple questions in a single question and collecting data using this format. Details we will see later on. Then, of course, when you are thinking of response options, remember that you have to limit to the number of response categories. You cannot have a very long list because that will lead to respondent burden and non-response. Then what is the sequence of these response, which the options? That is also very, very important. Many a times what happens is the respondent starts reading from the top to the bottom or from left to right. And the first option they feel correct, they will choose and they will not read the rest of the options which might have been more appropriate. So usually when you are placing your options, you should place the specific responses first and the general ones later on. Now, what does this mean? Now, example, from where did you receive iron folic acid tablets? Now, to the left, you see we have started with general and then we are going to specific. So, government health worker. Now, if the response is a medical officer, the respondent, one thing can happen, they will say government health worker, okay, yes. So, they will just select government health worker and go to the next question. They might feel okay, government health worker bhi hai, medical officer bhi hai. They might put a tick mark to both, or they might just not respond to this question. So what needs to be done is mentioned to the left, right. So you start from the specific response and then go to the general response so that the participant is able to comfortably identify the correct response. Now again, remember these closed-ended questions are better for a large survey. We have already seen some of the advantages, but they are simple to administer, and therefore in self-administered questionnaire, you prefer closed-ended questions. They can be in fact coded in the questionnaire itself and they are easy to enter as well as analyze later on. Open-ended questions can be a bit tedious and time consuming because you have to go back and create new codes for the answers you have obtained for open-ended questions. So these some differences you have to remember when you want to frame your questions. I've already mentioned about the uh, closed-ended questions and the limitations of as a loss of information. That is, this is again an example where you ask, what is your age in completed years? As an open-ended question. Some of you may prefer to ask it as age groups, so as categories. But remember that you lose some detailed information when you convert it into a closed-ended question. So it is always recommended that wherever possible, collect granular data so you have flexibility as to how you want to categorize that particular data in your analysis. Don't preferably make categories of continuous data in your data collection when you're designing your questions. So are you all with me till here? I think we have really just touched upon the questions and the options when you're designing a closed-ended question.
Yes, ma'am.
Yes,
Yes,
ma'am.
ma'am.
Now, these are some questions. There are some problems which you have to identify in these examples. So first is, do the distance and cost of the health facility prevent you from visiting it? So there is a problem in the question. You have to tell me what is it that you would like to change.
Ma'am, they are asking like two concept like distance and cost at the same time,
Correct. So what should be done?
like decomposition.
Correct. So you would ask distance separately and cost separately. So when you're framing questions, you please check each and every question and ask yourself whether more than one concept is covered in the question. Has your child had diarrhea recently? What
Ma'am,
is it?
recently cannot specify like recently, like last day or a week we are asking about
Yes.
what.
So the mother will not know whether you are asking today, now, week. So that recently is very ambiguous. You have to specify. How did you travel to the health facility today? Walking, bicycle, motorcycle.
There might be more options also,
Other
like
option.
Yes.
public
So there
transport.
could be other ways, right? Might be they have not traveled. So even if you assume they have traveled, there could be other ways which are not. So you can either add more options or add others and specify if you feel majority are going to use these modes of transportation. What is your source of information about anemia? Now, this example we have already seen. Then the number of ANC visits. What is the problem here?
Because 4 is
Continuous
included
data
in
is
both of them.
categorized.
So they can, they are overlapping. They're not mutually exclusive. Then do you disagree that government health services are not accessible?
Negative, like
Yes, there are double negatives here, which is confusing for the respondent. Do you think the improved government health services are better than private services?
leading question.
Yes, so this is a leading biased question. When you say improved, you are putting pressure on the respondent to say yes. Now Bhagyashree will not answer, somebody else will answer.
Yes, ma'am.
Do you possess an ABHA ID?
The abbreviation is used here.
Yes, so you have used an abbreviation, it could be a jargon, people may not be aware what you're talking about. Do you eat fruits frequently? Again, the word frequently, which brings in ambiguity. Then do you screen the pregnant women for GDM? So this GDM again is a short form which people may not know. Do you smoke? Nothing is mentioned now or no details. So this is not going to really help you much in your analysis. Since vaccines protect children from serious diseases, do you ensure child receives vaccine? Again, this is a very leading and a biased question and also threatening thing because you are saying vaccines protect. So the parent will think twice before saying no to this question. So be careful when you are framing your questions and also thinking of the responses to your closed-ended question. These are again a few examples from the NFHS. So you can see that there is a combination of closed and open-ended question. So you can have a you must not say I'm going to use only open-ended or closed-ended questions. You can have a combination of those questions. Wherever relevant, you can put your open-ended questions in your questionnaire. Again, here you can see that if you ask a question, what assets are owned by your household? The response you get will be different. But if you ask, does your household currently own any of the following assets? And one by one you are asking and you are ticking mark yes and no, then it is more likely that the person will not forget and answer to each question will be given. So in the NFHS, you will see the format in the right is used rather than the one in the left. And this is very important because why is this important? Anyone knows this question? Because it helps us to calculate what is known as the household wealth index. So this open-ended question is not going to help in any way. So how important is your question and the data you're going to collect also helps you decide how to frame the question. If supposing the household wealth index was not based on the assets owned by the household and these data were not that important, might be they would have asked just enlist what assets are there. But because this is so very important, because as all these data are going to help categorize the household for the socioeconomic tool which is used in the NFHS, this becomes important. So they are going to ask each and every of these options and see whether the answer is yes or no. So if the data you are going to obtain from the question is of prime importance, you have to go in details. So again, when you're thinking of questions, you have to first think of your research question, the objective. Then what information is needed to achieve the objective? What variables and items are needed? And then think right up to the analysis and the criteria on those items and the variable, which will help you to do your analysis and answer your research question. Thinking in this way will help you frame the question. So here I'm just giving you an example of a research question where we want to find out the prevalence of non-adherence to iron folic acids and the barriers. So you have to think through and frame your questions. This is just a checklist when you're drafting questions. Again, more or less it's a repetition, but quickly I'll go through the checklist. That is, keep wording simple, conversational, informal. Do not use jargons or sophisticated language. In fact, it is said just 12 words in the question maximum. You should try and frame your question in 12 words. And you check out whether it is your questions are understood as you want them to be understood in your pre and pilot testing stage. Then, of course, keep the cultural relevance and the educational status of your respondents when you're framing your questions so that you are confident they understand your questions. Avoid long questions. Avoid questions which are, asked in a very similar fashion, which can become boring and repetitive. Then, if needed, you have to define a concept. Like in the WHO tool, I showed you that there in the introduction itself, they have defined what they mean by vigorous or moderate activity. So you might have to define and clarify concepts where needed. Do not use leading questions. And when you're using any open-ended questions, as in your qualitative research, do not use why, because that is always threatening to the respondents. Do not use double negatives or any hypothetical questions. Sometimes we say assume or if something like this happens. So those hypothetical questions are usually difficult for the respondents to answer. Only one concept in the question. Sensitive, threatening questions, be careful. We are going to see in detail in the next session about sensitive questions. I've given examples of sensitive questions, like if you're asking questions on sexual abuse, domestic violence, drug abuse, alcohol, those questions you have to really frame very, very carefully. Then closed-ended questions, especially the others don't know options. Be careful about those, and whenever others is there, always it should be accompanied with specify or give more details. So this is something which you should, I think, remember when you are designing your questionnaire and your questions. These are a few references, couple of books and some articles which I am still reading, but they really give this particular topic in detail. And as I told you, you will find that there are books on designing the questionnaire, the questions, there will be interesting articles, and this is a domain in which you can build your expertise and which is a very important component of any research study. Now, in the next sessions, which will be covering topics are types of questions with regard to the measurement scale and the structure, in detail about the sensitive questions, then the length and the order, sequence, layout and coding. Then we'll also try and understand domains. That is, you know that we collect data on knowledge, attitude, practice, healthcare seeking or behavior. So what are those really domains? What do they mean with example? Then validity and reliability. What are the components of validity of a questionnaire, reliability, then translation. Then there are so many standard questions which are available or questionnaires which are available. So how to use them? Is there like for the questions, for the questionnaire, there is a checklist which I would like to share. And then of course, I am telling you right from the beginning that we are talking of using a questionnaire for quantitative studies or quantitative research. So you know what is the stance which we are taking, that we are able to use a questionnaire for quantitative research is what we will try and discuss as we move ahead on this topic. So I'm going to stop here before I touch upon this particular question. I'll just stop the recording actually. I want to stop the recording.